Well, now to an unexpected impact of the federal government's return to office mandate. Doctors say they're seeing more public servants asking for medical notes to be able to work from home. The extra paperwork requires extra time, adding more strain on the already overtaxed healthcare system. CTV's Katie Griffin is live with more on this. Katie.
Well, Patricia, some doctors I spoke to say the paperwork associated with these requests add an hour or two to their administrative work every day, and that while some have medically legitimate reasons, there still should be some healthy skepticism.
Paperwork may be part of the job, but Dr. Ali Khan Abdullah says there's now a lot more of it.
The numbers are building up. So this has only started since September. We're at about 2 to 5 accommodation requests per week.
He says ever since the federal government required public service workers to go into the office more often, the number of requests for doctor's notes to work from home has jumped.
Have to have a conversation. Does this make sense? Does it not make sense? Does it meet the criteria the government has for accommodations, or is it something more about standing in opposition against returning back to 3 days a week?
He says some patients have legitimate medical reasons, others may not.
Environmental allergies, too much light, too much noise, not having an actual desk, being more worried about COVID and the environment. These things become a little bit more concerning because they don't have true medical correlation or substantiation for the reason why they need the accommodation.
It speaks to the work-life balance. For a lot of our members, working from home meant better mental health, physical health, and just better concentration and focus. And productivity especially.
One union representing public servants says some who were previously accommodated before the pandemic are having to put in new requests.
But managers are also sick of having to go and be hall monitors and check off bums in seats rather than do their work.
The Treasury Board of Canada says accommodation requests are handled on a case-by-case basis by each department, saying in a statement managers should proactively discuss with employees any barriers they may encounter and define solutions that will help address them in the workplace. The workload adding to the strain on the healthcare system.
I don't want to be a policeman. I don't want to be an adjudicator. That's not my job. My job is to look after people's health care.
The Treasury Board does not have data on how many requests for accommodation have been received or how many have been granted. Patricia.
CTV's Katie Griffin live for us tonight. Thank you.